Good morning. My name is Suzanne Belmonte, and I am a volunteer with MSU. I have dermatomyositis and was diagnosed in September 2017, about 4 months after being diagnosed with non-Hodgkin's lymphoma. At that time, my non-Hodgkin's lymphoma was pretty quiet, and I was on a watch and wait protocol until about September, where I started to exhibit some symptoms, fever, achiness, and at first we put it up to that it was just a byproduct of the non-Hodgkin's. Eventually, it did lead me to being in the hospital for about 5.5 weeks, followed by about 2.5 weeks in a rehab facility. At that point, I was unable to move, use my legs, move my arms, really lift them. I couldn't lift my head. I needed help with all ADLs. I just was in bad shape. We weren't exactly sure what was going to happen. The doctors were completely unfamiliar with dermatomyositis, and they had to bring on teams to come and view me and see me and try and figure out what was the best course of action. Thankfully, I have come back to about 80% of where I was. When I was in the hospital, they had to also give me a feeding tube. I was unable to eat for about 3 months. I couldn't swallow, so I had to have a suction because my mouth would fill up with saliva. So it was a scary time, to say the least. I am now, as I said, about 80% of where I was. I'm able to walk and use my arms and take care of myself. I do fatigue very easily, and I still have muscle discomfort and pains and a lot of weakness, but we're getting there. So that's the upside. I have been part of MSU since probably about 2018 or so, and volunteer as an admin, and also work behind the scenes with some data entry and working on a provider database. I am so thrilled to be able to work for MSU or with MSU as a volunteer. They're an important organization that has helped me throughout my journey and continue to help me. And the idea of giving back is just great because it's such a valuable asset to have. I currently am behind the scenes, as I said, with MSU and hope to become more an integral part of it. My profession by trade is a speech pathologist, ironically, and had to receive speech therapy, so it gives me a new understanding for what, a speech therapist does and what patients go through. My medications include IVIG, obviously, rituximab every 3 months. That's really part of my maintenance program for my non-Hodgkin's, but it also serves double duty with the myositis, thankfully. Also am on Plaquenil and methotrexate injections I give myself once a week. I just came off of my steroid of methylprednisolone or Medrol, and that was after 3.5 months on the steroid. So I still have some of the effects of that, and I'm hoping that will go down as my body gets used to not having that anymore. As I said before, MSU is so important. It helps so many patients and helps whether they need some financial assistance, emotional support. They're my peeps, they're my family, and it's the first place I turn to if a new symptom has come up or a new medication, something just feels off, or I need to reach out to somebody who gets it. MSU is there. We are a family of people who were brought together by unfortunate circumstances, but have really developed such a strong bond. Please feel free to reach out to any of us, whether we're volunteers on the admin team or just other members. You will be welcomed with open arms. You can reach me either on the Facebook group, or please feel free to email me. You can email me at suzanne@understandingmyositis.org, and I'd more than be happy to chat with you and see if there's any assistance I can give you. I wish you the best of luck on your journey, and please know that we are all here and we are in this together. Thank you so much, and I hope to see you on the Facebook group. Bye-bye.